What's up YouTube, Dr. McIntosh with Health and Performance Center here, just hopping on here to make a video about muscle strains. And before the video starts, make sure to subscribe to our YouTube channel and drop a like and a comment on this video. So this is Muscle Strains Part 1. Again, Dr. McIntosh with Health and Performance Center. So our objectives here, we have three. We want to identify the types of strains or classifications. We want to discuss the pathophysiology, basically what is happening, and determine how to diagnose that. Type of strains, there are three types. It doesn't really matter what you call them. But there's really three big ones, one being a very minor strain. Only a few muscle fibers are torn, and you get a little discomfort, but the function is maintained. There's a moderate tear where it's less than 50%. You can get some minor bruising, petechiae, and some altered muscle function. Then there's the big one, which I call type 2 here. Really, you can call it whatever you want. 3A, doesn't really matter, which is over 50% or a complete tear of the muscle. Be severe bruising and a total loss of function. It can be in the proximal, meaning more towards the head, the middle, or the distal site. Depends on which muscle it is. Depends on which is worse. Like a distal tricep tear is worse than a distal hamstring tear, right? Proximal hamstring tears are worse than distal ones in that case. The pathophys, what is actually happening? So here's a healthy muscle cell. You can see all the labels here. The muscle fibers, the nucleus are the gray circles are the satellite cells. So what happens? Number one, the fibers get overstretched or overloaded. Super common for muscle strains to happen in the eccentric portion of a lift or activity. So you get a rupture of the physical muscle fibers. And this is showing a muscle fiber. This is not showing a complete tear of a whole muscle, just a fiber, right? So it tears. You get all these little guys in the middle, macrophages, neutrophils, etc. Have to clean it all up. Once it's cleaned up, then you get the satellite cells. They kind of create this bridge, and then they'll start to make it all regenerate, and eventually it'll be fully repaired. Now, once it's repaired, you have to get the strength back, its integrity, etc. But muscle strains are a little bit different than tendons because if you have a partially torn tendon, it's probably not going to grow back. If you have a partially torn muscle, it most likely will grow back, depending on the severity. Next, so the diagnosis. Well, number one, history is super important because if you're a couch potato, you're probably not going to tear your hamstring. But if you're a soccer player who sprints a lot, a football player, etc., it's more likely. So sports are super common. Weekend warriors, people that like to go from not a lot of activity to a ton of activity. And then observing it is also huge. If you think you totally ruptured your bicep, but it's not bruised in any way, probably didn't, right? Or if there's a tendon that might be detracted, that's super common in the bicep. You can just look at it and tell. And there's a sign where you can hook it with your finger. If you can lift it up with your finger, then it's probably torn. And then some passive muscle testing. Basically, when you squeeze it, is it still contracting and pulling on that distal site, making whatever it is move. And then lastly, diagnostic ultrasound. It's kind of the new guy on the block. A lot of people are doing that now. It's very quick and very cheap compared to, let's say, an MRI. MRI is still the gold standard, I believe, but diagnostic ultrasound is coming up quick. So what next? Next video we're going to talk about basically just some basic rehab principles for muscle strains. We might get into some specifics just because calf, hamstring, and rectus femoris are the most common, so we'll probably touch on those as well. But anyway, guys, thanks for watching, and make sure to subscribe to our channel.